Good afternoon. Just wanted to call this meeting of PSTE to order. First, want to start by how we acknowledge everybody, how we start always. We just want to acknowledge the members of the committee. First, I'd like to acknowledge our veteran, Senator George Edwards, Senator Michael Jackson, Senator Johnny Ray Sailing, and today we will have, it looks like, 3 respective agency reports. And I guess that we'll get started with the first one, Maryland Insurance Administration, with our budget analyst, Kelly Norton.
Thank you, Mr. Chair. The Maryland Insurance Administration's budget increases $1.5 million to $35.1 million in fiscal 2023. The largest portion of the budget goes towards personnel with 79%, followed by IT spending. The budget increase of $1.5 million is due to many factors. Personnel costs increase due to health insurance for employees and retirees. Other factors increasing the budget is increased spending on new equipment such as copiers, an ongoing IT project, and various IT items. MIA conducts a review of every insurance policy and contract to ensure that all legal requirements for the policy and contract are met. The agency also reviews and approves rates for most life and health and property and casualty insurance products. This exhibit shows form filings increased in fiscal 2021, but are expected to decrease in fiscal 2022 by 6.5% for total life and health forms and 11.5% for total property and casualty forms. The percent of forms reviewed within guidelines was 96.8% in fiscal 2021 and expected to decrease.
We don't have a solution.
And expected to decrease to 95.8% in fiscal 22. The Fraud Division is responsible for investigating complaints relating to alleged insurance fraud committed by insurance companies, producers, or consumers. In fiscal 2021, there were 329 referrals open for investigation, up from 247 in 2020. There was also an increase in the percent of open referrals investigated and referred for criminal prosecution. It went from 35% in 2020 to 67% in 2021. However, the percentage of cases closed within 180 days remains low at 41% of those opened. The agency points to the pandemic's effect on daily operations, 2 long-term criminal investigations, and attrition issues in the Fraud Division. The agency is currently recruiting 2 positions for the division. The agency also depends on Excel for case tracking. MIA should comment on how the new tracking system will improve its operation and the expected implementation time. The Office of Legislative Audits released an audit of MIA in March of 2021. There were 8 findings, including 1 repeat finding, indicating that MIA continued to use premium tax spreadsheets that lacked adequate controls to ensure the propriety of tax data recorded and the results of premium tax audits. MIA should comment on the audit findings and its efforts to address the issues raised in the audit, particularly the adoption of an automated system to address the repeat finding. MIA had 2 repeat findings in the statewide review of budget closeout transactions for fiscal year 2021. MIA cannot readily explain a $1 million deficit in the Health Regulatory Fund that was improperly offset by unrelated surplus funds in the Insurance Regulation Fund. MIA should brief the committees on, should be prepared to brief the budget committees on the reason for this continued deficit and the corrective actions that are being taken. For the second finding, MIA failed to justify the retention of $3.3 million in the Health Care Provider Rate Stabilization Fund. MIA has argued the funds are necessary to cover any premium tax refunds to health maintenance organizations and managed care organizations. MIA should brief the budget committees on the current balance being held in the RSF and provide further explanation as to why it believes that these funds had to be retained, including a time frame on potential refund requests. In summation, DLS recommends concurring with the governor's allowance. And this concludes my presentation, Mr. Chair. Thank you.
Thank you, Ms. Norton. At this time, I'd like to bring up the agency representative, Ms. Our Commissioner Bahrain, and her team.
Thank you very much, Senator McCray, and good afternoon to the members of the subcommittee. My name is Kathleen Bahrain. I serve as the Maryland Insurance Commissioner. With me today is Greg Durwart, who is the Deputy Commissioner. Deputy Commissioner Durwart manages our operational team, including our fiscal unit, and he will speak for the agency today.
Thank you, Commissioner. Good afternoon, Senators. Nice to be with you. In terms of our fiscal 23 budget, Kelly identified two major items that were increases from the previous year. The salary increases, which are being put in place across the board by the governor for all state employees, as well as increases to our technological improvements. So let me point a couple things out there. Our insurance tracking system, ITS, is a project. It's a major initiative to replace our legacy enterprise system. We're in the beginning stages of this 3-year project, so that's a portion of that. Also, new budget items under our contractual services line include enterprise network switch replacement, server replacements, as well as several cybersecurity upgrades, including supply chain monitoring, threat intelligence software, supplemental cybersecurity training, and cloud-based security monitoring tools. Ms. Norton also asked us to to respond to the March 2021 audit and our response to that, mainly regarding staffing and fiscal operating procedures. I'll mention that we've updated and are implementing revised standard operating procedures for our assessment and accounting data entry processes. We've hired new staff who are assisting in implementing these new procedures, and we've also engaged in the services of a CPA consulting firm recommended by the Controller's Office to assist our Fiscal Services Unit implement these revised SOPs and provide recommendations on staff training and any restructuring. Then in terms of the repeat finding regarding premium tax spreadsheets lacking adequate controls, we had a two-pronged approach to this. First, to improve the existing process. While there's always going to be an element of manual processing for our financial regulation division, which needs to estimate the carrier premiums and make sure that they're placed in the appropriate categories. And these processes have been detailed and forms have been adapted to document these steps. The part that can be automated has been through a pretty sophisticated spreadsheet programmed by our actuarial team. Cells are locked so that once the financial analysts input the data, the calcs are performed and the amount to be billed to each carrier subject to the assessment is identified for our fiscal unit, which then performs the task of invoicing and collecting the amounts. Then the second step, we referenced the hope of automating the system. Now that we've documented the process and we've ensured that we're following COMAR requirements, we can now look at options for automation. If we can find an off-the-shelf system that would be customizable, that would be our preference. We also plan to see if automation could be incorporated into this ITS project that I mentioned to you through a possible contract modification. And then the two questions that stemmed from the closeout, two of our assessments. First, the Healthcare Regulatory Fund. The deficit balance was acknowledged in our responses to the March 2021 audit findings and recommendations. In consultation with our legal counsel, we identified a plan for recoupment, which the OLA audit team determined to be satisfactory when we were going through that audit process with them. The result of the first year of the recoupment plan resulted in a decrease of the deficit balance from approximately $1.4 million at the end of fiscal 20 to approximately $1 million at the end of fiscal 21. The MIA's plan of recoupment aims to eliminate the deficit balance in the fund by fiscal year 2025. And then regarding the rate stabilization fund, the MIA has historically retained a balance in the rate stabilization fund to fund premium tax refunds to companies that had overestimated and overpaid their premium tax and are entitled to a refund. The practice was acknowledged again in our response to the March 2021 audit findings and recommendations. As of the end of fiscal 21, and in anticipation of the repeal of the rate stabilization fund on July 1st, 2021, the MIA transferred over $208 million to the Maryland Department of Health and retained a balance to address these potential refunds. Because the fund has sunset, there will be no future revenue to offset or fund refunds. So the MIA, we were intentional about taking a conservative approach to retaining funds. The amount of the funds currently retained as of December of 2021 are just over $3 million. Now, pursuant to Section 6-109B of the insurance article, the Commissioner has up to 3 years to audit premium tax returns. The deadline for an insurer to file a claim for a refund is 3 years from the date that the tax, interest, or penalty is paid. That's pursuant to Section 13-1104A of the tax code. It's the recommendation of our legal counsel, as well as the legal counsel of the Office of the Controller, that the MIA retain this balance for this 3-year period. So given the advice of the OAG, the MIA intends to keep the funds until the period for requesting refunds has expired. The last payment had been received in June of 2021, so we would hold the funds until June of 2024. So in conclusion, the DLS concurs with the governor's allowance, and we ask you to look favorable on our submission, and the Commissioner and I are here to answer any questions you may have.
Thank you. Just one question. Do you all still report out in reference to the audit findings, that especially the one repeated action? So like, obviously you said that the first years went in the direction that you needed to go, but how will we follow the issue just going forward?
I guess I would have to ask OLA. They would review it every year. So the plan that we had intended to reduce the historic deficit by 25% each year. Mm-hmm. And that is what we're doing. And that's identified in all of our records. What we send GAD at the end of the year is at a higher level than that. But the auditors are evaluating it every year.
And you said they do evaluate every year. OLE is evaluating that
That's
every
my
year.
understanding, is that they're tracking it. That's why they looked at it this year.
Okay, got it. Thank you. Seeing no, Senator Edwards.
Thank you, Mr. Chairman. No question, just a comment. I want to thank the Commissioner and her staff came out to Garrett County one evening and met with the local officials. We really appreciate that. And then the next morning went to Allegheny County and met with them. So thank you very much.
You're very welcome. It was our pleasure.
And Commissioner Bahrain, I'd also like to just piggyback and pile on to Senator Edwards. Just thank you for helping us with this MAIF issue. Your agency was definitely a great opportunity to be able to work with them and move it in the right direction. And just thank you all for your leadership, especially through a pandemic. We know that everybody's dealing with the Great Resignation, and hoping that you all do well as we move forward with the state of Maryland. And Ms. Norton, just wanted to thank you for your dedication, commitment, and detailed analyst report. That ends the hearing for the Maryland Insurance Administration. And next, it looks like we will bring up the Department of Public Safety, Division of Pretrial Detention and Services, and we'll bring up analyst Jacob Cash. Mr. Cash.
Thank you, Mr. Chair. As you mentioned, my name is Jacob Cash. I'm the policy analyst for the Department of Public Safety and Correctional Services for DLS. The budget for the Division of Pretrial Detention and Services is $261 million in fiscal 2023, which is a $25 million increase over 2022. Going into the performance evaluation, starting with populations, as you've seen with many agencies in this department, there was a population decline. Exhibit 1 shows arrestees processed and the rate of commitment for those arrestees. In fiscal 2020 and in 2021, there was a substantial decline, mostly related to the COVID-19 pandemic. The rate of commitment did increase, but the populations that were coming in and being processed at Baltimore City, booking and intake decreased. Exhibit 2 shows the population of each of the facilities in Baltimore City, and overall, the population was steady between 2020 and 2021. The share of local detainees increased, and most of that is due to the court delays preventing pretrial inmates from being processed and moving on to the next stage. And there was a decrease in sentence offenders related to fewer intakes to the correctional system. A big change in this budget this year is that the Baltimore pretrial facility in Jessup was closed at the beginning of fiscal 2022. The inmates and the staff that were assigned to that unit were transferred back to Baltimore City. This, as some of you may recall, was a temporary solution to overcrowding in Baltimore City that was related to the closure of the Baltimore City Detention Center. I'll be touching a little bit more on that situation in just a moment regarding the Duval case. However, as a whole, this is a great move and reduces the amount of overtime required for inmate transport, as well as keeping people further away from their homes and families. Exhibit 3 shows the assaults in Baltimore City facilities, and these were stable overall between 2020 and 2021, but there was an increase in assaults in Baltimore City Booking and Intake Center. Exhibit 4 focuses on the pretrial release supervision program. Baltimore City inmates may be assigned to pretrial supervision prior to their case being heard rather than being placed in detention. The amount of referrals has been pretty steady over the past few years, a slight decline in 2021. And the number of pretrial investigations did slightly decline this year as well. And Exhibit 5 shows the failure to appear rates of these individuals for their court cases. This is some of the lowest rates we've ever seen. You know, and to be fair, this is one of the easiest years to do that because well, court trials weren't occurring at the rate they had in the past, and most of those trials at least had the option of having a virtual appearance. So the excuses to not appear became fewer, and we saw fewer people fail to appear. Moving on to the budget, this breaks down the allowance. 74% goes towards personnel, and that's the largest proportion of any agency in this department. Inmate medical expenses also make up a large share, and about 12% of other expenses go towards operating the facilities and keeping them running smoothly. The overall budget change of $25 million is broken down in the Where It Goes chart on Exhibit 7. As I mentioned previously, the transfer of Baltimore City, staff from Baltimore Pretrial Facility in Jessup increased the allowance. There's approximately $1.1 million associated with those positions, but there's also other operational expenses that were transitioned, including medical expenses that increased by almost $9 million, and food expenses that increased by over $1 million. So as I mentioned, there's an increase in positions. There's 18 in total, and most of those were from BPFJ. Turnover was also adjusted in fiscal 2023, allowing them to hire more positions, and adds about $3.6 million for that. Exhibit 8 demonstrates the vacancies in this division. As is the case with most of the divisions in this department, there's high vacancies within many of the administrative classifications. Office staff are 40% vacant, as well as maintenance staff, psychologists and counselors and social workers. And there's a third of positions vacant for supply rec officers, pretrial supervision agents, and dietary staff. All of these individuals and classifications are important to functioning of this division and keeping inmates safe and keeping the correctional officers' jobs easier. Moving on to the issues of this division, the first is the Duval settlement case. And to remind you all, in 2015, the ACLU filed on behalf of a previous settlement to reopen it and required the department to fix a number of deficiencies. The major areas that required changes are listed in these bullet points here. The the three major areas are medical care, mental health care, and the physical plant conditions. The physical plant conditions reached substantial compliance the first in September 2018, followed by a few medical and mental health requirements. The department is still in the process of satisfying all of these requirements, and they're only in full substantial compliance for a few areas. Sick call is one of those areas, but one of the areas that require some of the most improvements is with Americans with Disabilities Act compliance. There is an ongoing survey that was delayed due to COVID to determine the fixes that were required at all the correctional facilities, not only to make ADA compliance for inmates, but for the staff and the public as well. They were delayed several times during the pandemic, but are currently scheduled to finish sometime in March of this year. Overall, there is a list in Appendix 2 of all of these provisions stating if they are in partial, substantial, or in non-compliance. But they are engaging in a few steps to solve and fix these problems. The first of which is a $750,000 contract for attorneys and other experts to help them reach compliance on all of these provisions within 18 months, which is the goal. The second way that the department is tackling some of these issues is pursuing a therapeutic treatment center in Baltimore City, which receives funding in fiscal 2023 to continue design. There's also an ongoing effort to secure a substance use disorder treatment services contract, which I'll be touching on just in a moment. And lastly, there are major IT projects which are ongoing to install an electronic patient health record to satisfy some of those medical requirements, as well as a computerized criminal history project, which is has been delayed in the past, but is nearing implementation and will help collaboration between case management. Moving on to issue 2, which is the substance use disorder treatment services. One of the sub-provisions of Hogan v. Duval is to increase the amount of mental health and substance use disorder treatment services they provide. Exhibit 9 shows that they haven't been spending the appropriation for these sub-programs as much as they have or would be expected to, especially due to statute which required installing a pilot program for medical assisted treatment of opioid use disorders, which is requiring to be implemented by fiscal 2023. The funding was restricted in past sessions, but it wasn't fully used when that was done. However, the money was not transferred to other purposes, which is a positive in the eyes of DLS. The total amount of spending for the staff in these sub-programs was about $2 million in fiscal 2021. It's $1 million below the amount approved for staff in that year. And this exhibit 10 shows the vacancy rates for these staff in these programs. Currently, there's the highest vacancy rates for associate and professional counselors, which are the base operators for substance use disorder treatment services. Procurements have also been canceled and delayed in the past, somewhat related to the budget conditions in the COVID-19 pandemic, but also related to difficulties having satisfactory responses to the RFPs. There is a current contract that is set to appear before the Board of Public Works on March 23rd of this year, and that contract will help to improve this program and allow services to be expanded to a majority of the inmate population. The current programs that are available are listed under the MAT programs on this page. There are limited opportunities currently. The major drug that is offered is methadone continuation as well as initiation for some inmates. But by and large, the department remains deficient in supplying substance use disorder services to inmates. Lastly, there is some information on the local MAT programs, which is required under current statute to be reported on by the Governor's Office of Crime Prevention, Youth, and Victim Services. They're not currently providing information on every MAT program across the state, but they are required to by fiscal 2023. The current programs are only those being funded as a part of the pilot programs. Sorry, not being, being funded as part of the pilot programs. The one recommended action that DLS has for this budget is to restrict the remaining substance use disorder appropriation of $9.8 million, which was done last year, and that would prevent the funding from being transferred to other purposes. It would require them to either spend it or be reverted to the general fund. As I mentioned, there's some more appendices with more information that you might find useful, but that concludes my presentation, and I'd be happy to answer any questions you have.
Thank you, Jacob, for that detailed report. Any questions from the members? I have no questions. Mr. Secretary, you and your team are on.
Very good. Good afternoon, Chair Jackson, members of the PST Subcommittee. Just for the record, my name is Robert Green. I am the Secretary of the Department of Public Safety and Correctional Services. With me today at the dais is Michael Resnick. He is our Commissioner of the Division of Pretrial Detention and Services. Sasha Vasquez, our Acting Deputy Secretary of Administration, is here to answer your questions, as well as Ms. Dion Randolph, Deputy Commissioner of the Division of Pretrial Detention Services, Nigel Roberts, our Chief Financial Officer, and also our Chief of Staff, Rachel Cassessa. We do appreciate your ongoing analysis, Mr. Cash, and your observations. As I have in every hearing I've set before you, really want to thank our staff of this division and the work that they have done over the last 23 months. Just an extraordinary group of people working across this system that did and continue to do every day fantastic work for us. The analysis contains one issue for us to comment on, one recommended action, and I would start, Mr. Chair, by stating that we concur with the recommended action. The one issue that the department was asked to comment on is specific to the status of the Duval v. Hogan settlement agreement. I would tell you that this litigation is a class action lawsuit that began in some nature 44 years ago. It was filed by incarcerants housed in the certain Baltimore pretrial facilities. The major complaints, as noted by Mr. Cash, asserted that the physical plant conditions and the provisions of medical and mental health care were unconstitutional. The litigation was initiated prior to the state assuming control of these facilities, and again has been in existence via multiple iterations over the years. I'm frankly incredibly proud of everything we have done and that Commissioner Resnick has done, along with Deputy Commissioner Randolph and their entire team, to bring this settlement into compliance over the last 3 years. Despite every challenge we faced, the department has made absolute significant gains in this litigation. The court monitors did find the department to be in substantial compliance with all the provisions of the physical plant. That's sanitation, maintenance, dietary facilities, and that was completed in 2018. The portions concerning medical and mental health remain. However, the court monitors have found the department to be in substantial compliance with 19 provisions and partial compliance with 25 provisions of the remaining section of the agreement. And I would note to you the most significant number of all of those have occurred since 2019, working closely with our medical vendor that we have now, but under the direction of the commissioner as well. The department continues to work with the court monitors, healthcare providers, to come into compliance with those provisions where we are partially and or non-compliant, of course not seeking to backslide anywhere as well. There are two key areas the department's working to improve upon to reach that full compliance. That's the implementation of a new electronic medical record system that is underway. We have a contractor that is working with us to build that system. The modifications of space to improve clinical care is another. We utilize a hybrid electronic and medical record and a paper record within the system. Both the medical and mental health monitors are of the opinion that the department cannot be fully compliant with the settlement agreement until that automated electronic health record is in place. And again, we're working diligently towards that end. We're also involved in the space allocation issue as it relates to compliance. The medical monitor is of the opinion that certain clinical spaces are inadequate to to provide the appropriate care. And the department continues to work with the monitor and its providers to adjust operations where we can, establish, spaces where those procedures and processes can be done appropriately. So we do continue to plan the Therapeutic Treatment Center, as Mr. Cash noted. That is funded, has funding in FY23 and budgeted funding through FY 2027. And that is a purpose-built, designed therapeutic treatment center that we have prepared a space for in Baltimore City through the demolition of the previous facility that is there. That concludes our testimony, Mr. Chair, members of the committee, and we're more than pleased to answer any questions you may have.
Thank you, Mr. Secretary. Look, I have a couple of questions before we move to the other members. One, could you address the ADA challenges? I know, this has been an ongoing challenge for you all with the facilities, but could you speak to the progress in that regard?
Yes, Mr. Chair. The ADA, when I got here, we recognized we had some ADA challenges in past litigation around ADA. The study, which drives all of the modifications and things that need to take place, was began. And again, as many things happened in COVID, it stalled at multiple times, and at times absolutely stopped because it was not safe to continue that through the various surges. We are on track. It is a very purpose-driven report, and it will drive our ability of how we need to modify old facilities and look at how we prepare not only for the population we have incarcerated, but our staff. And as Mr. Cash has noted, we hope to receive that later this spring.
All right, that's terrific. Speak briefly regarding CDF, Chesapeake Detention Facility. In your I know a little bit about that. Can you kind of bring us up to date on that a little bit with the U.S. Marshals?
Certainly. Again, thank you for that question, Senator. We submitted a JCR around CDF in the fall. We began well over a year ago with discussions and attempts to modify that contract. I would turn it over to Commissioner to tell you where we are today, but there's been substantial movement there.
Certainly. Thank you for that question, Senator. So since the Joint Commission report, we've had substantial negotiations with the U.S. Marshal Service. We actually submitted a proposal to them for modification. We've heard back with them with a counter proposal. We are very close to finalizing a deal with them to come into an agreement. I anticipate within the next 30 to 60 days we should have something finalized. So we're very, very close.
I appreciate that. In reading the documentation, that you're working with them, one of the recommendations was for you all to sort of reduce your intaking. So I know that's challenging in every jurisdiction, particularly in your jurisdiction. Again, I have a little bit of familiarity with that, but could you speak to the challenges as a whole with, I guess, even that proposal of reducing your challenges that may come about? So I think on the 3rd of November, Secretary, you all had a meeting with them, and it says, requested that the department propose a time frame for scaling back the number of federal detainees housed. Sometimes in the public safety world, you don't have that, you don't have that luxury, right? So what challenges did that create in that area?
I would tell you, without getting deep into the negotiations, Senator, and we're almost there, and we'll be happy to share that when it's completed. We're reaching a balance to make sure that we do not affect anything that's occurring in the federal courts in Baltimore City, and we're able to service the full needs of the U.S. Marshal's Office. We've worked very closely with Marshal Hughes, making sure that that data is available so we can, one, do that and service those needs, but two, also be conscious of the needs of the state. In balancing out the remainder of that contract, which was a 15-year contract that was implemented in 2010, I believe, and expires 25, Commissioner?
Correct.
And I think we have reached a balance point, and we are very close.
Okay, that's terrific to hear, and please keep us informed as best you can outside of the negotiations. And lastly, for me, obviously, Ms. Vasquez, we talked about this at our last meeting, and Ms. Secretary, the civilian vacancies. And again, once again, this committee, you know, we are willing to do our part in helping you all with that. It's vital, particularly in today's climate. You know, much of the report today centered on the medical component. And if you all don't have what you need resource-wise, you know, our expectations are kind of futile. So we certainly want to continue to work with you all. You know, those are some astonishing numbers there. Those are numbers we typically see on the sworn personnel side, but you know, we appreciate you sharing it. And again, our commitment is to help you all rectify that as quickly as we can. Any questions from the members? Senator Solins.
Thank you, Mr. Chair. I want to thank you, the Secretary, for getting back to me about, I know it's been tough getting the work that you need and then filling in those positions. And I see some of the transfers and some of the things that has happened. And I'm hoping, again, and I know you're working on it, but again, I'll stress, if there's anything that we could do to help this out, because we know, we see everywhere I go, I'll go to Royal Farms or anywhere else, help wanted, hiring. So if we could do anything else as a committee, please let us know, because I know it's important to fill those positions, because I know people are tired working all that overtime. And I know it stresses out the budget, and it doesn't help that out. So if we can do something, let us know, because we want to help that out. Thank you.
Thank you, Senator.
Mr. Chair.
All right. Obviously, as we all know, employee safety is paramount, so.
Yes.
As well as those we're responsible for. So, thank you, Mr. Secretary, and your team. We will see you all probably next week.
Thanks, Senator.
Thank you very much.
Take care. Have a great day.
Committee, thank you.
It's a nice tent, man. Even a nice tent up there. Is your tent there?
No, I wish it were. Just, I'm sorry, so.
Would you let me close this door for you? It's getting a little loud out there.
That's probably the next group coming in. But I appreciate that.
Yes.
Good. All right, good afternoon. Secretary Ports, come on up. Our next hearing is the Maryland Department of Transportation, Maryland Transit Administration. We have before us today Secretary Ports and his team, and we will have our budget analyst, Steve McCullough, lead us off.
Okay. Thank you, Mr. Chairman, members of the committee. Steve McCullough, Department of Legislative Services, here to present the Maryland Transit Administration budget analysis for fiscal 2023. The operating budget for MTA increases by $25.5 million, or 2.7%. The PAYGO, which we'll discuss in more detail in a little bit, decreases by $460 million, or 38.6%. Most of that, as you'll hear, is driven by high spending in 2022 for the settlement of the Purple Line project. Jumping right in and looking at the impact that COVID has and continues to have on MTA services. This exhibit shows the ridership by mode, and you can see the big drop at the beginning of the pandemic, and since then, Ridership has generally improved, but not at an equal rate. And you can see, especially these bottom two, the MARC service and the commuter bus. Very similar to other commuter systems across the United States, commuters have tended to switch and keep maintaining, remote work. And so that is really impacting that service. But even some of the other service, like Core Bus, still remains, significantly below pre-pandemic levels. That does translate through on the fiscal year ridership numbers. This exhibit shows the change in percentage in boardings by mode. And these last golden bars in each segment are the estimate for 2022. And MTA, is expecting to see some ridership rebound. And because these are comparing the prior year, that's why you see the big increase in 2022. Things actually, it's not necessarily pre-pandemic levels. It's just compared to the prior years. However, I would note a note of caution that through the first quarter of this fiscal year, ridership was still down across the board compared to the current, to the prior year. So it would take some pretty substantial increases for the rest of the year in order to actually see these estimates achieved. Exhibit 3 shows on-time performance for each system, with the black line at the top of each cluster being the goal for that particular mode. And you can see for the 5-year period how each system has or has not achieved its on-time goal. Related to that, for mobility, although it looks like mobility is fairly good here in fiscal 2021, the next exhibit shows the monthly numbers for calendar 2021. So the first half of this up to the red line was in 2021. The second one going forward is in the current year. And you can see that it has been well below the goal for on-time service, and we've asked MTA to comment on the causes for that and the steps that it's taking to mitigate that. Lower ridership, this is similar to what we saw with WMATA. Lower ridership really does translate into a much lower fare box recovery. The same thing goes for the performance measures, where we're looking at various things like the passengers per revenue mile. Those bars have generally been down. And then the cost, because there's sunk cost for operating the service, you can see big increases in the cost. And again, these are percent changes from the prior year. So things were up last year, but they're even up compared to last year. So even on this last one, that's an increase over the prior year. Exhibit 7 shows a peer comparison for the bus system, since that bus service is MTA's largest service. MTA is required by law to compare itself against peer systems across the United States. They do so for not only the bus, but for light rail and metro, et cetera. But since, again, bus is the largest, that's the one I include in this exhibit. And the shaded parts show where these peer systems are performing better than the MTA system, which is noted as Baltimore. The second line here is the average for the entire group, including Baltimore. And it does show that for the fiscal 2020, Baltimore actually was better than the average for the group. But as you see from the shading, there are certain systems that have done better on certain components. Exhibit 8 turns to the agency spending and shows that, as I discussed, bus operations are the largest component, and that's where the largest amount of funding is contributed to. Looking at the change in the budget, as I indicated at the beginning, $25.5 million increase, 2.7. The largest areas of increase result from the annualization of returning to full service for the MARC and commuter bus. So those services returned to full service last August. That was less than a full fiscal year, so this brings in the additional money for 2023 to cover the full year. Also, there are contracts that are used to provide MARC, commuter bus, and mobility services, and those have annual increases built in as well. Other than that, there are some puts and takes I will note on the COVID cleaning, there's a couple contracts and cleaning supplies that decrease. And then there's an offsetting one in the new contract for Metro cleaning that offsets that slightly. But overall, most of that increase you could attribute to those return to service and the annual contract increases. Looking at personnel, there is one additional position in MTA. This is a interdepartmental transfer. Across the whole department, there were no changes in regular positions. Exhibit 10 starts the discussion of the PAYGO capital budget. And Exhibit 10 shows the 6-year program funding for MTA by category. And you can see, as we'll be talking in the next few exhibits, this large increase in 22 and then smaller amounts going forward is largely driven by the purple line that is spent in 22, and then that's no longer in the future years. Exhibit 11 shows the total PAYGO capital program for MTA, and it's sorted by in descending order for the magnitude. So you can see that Metro Rail Car signal system overhauls comprises the largest project in the fiscal 2023, and on down the line. In addition to specific projects, there are kind of programs. These are things that they're doing every year, like bus procurement, system preservation, that will always be ongoing. Again, those are sorted in descending order. In total, for fiscal 2023, the PAYGO capital project program for MTA totals $803 million. Exhibit 12 shows the cash flow, and this shows that last year when the 22 budget was introduced, the purple line spending for the settlement and for the repayment of the bonds was not anticipated, and or it was anticipated but unknown until it was certain it was not put in the budget. So there's a big increase between the budget is introduced and the current working appropriation, and then when those funds come back out, it drops back down. And the next few exhibits kind of show that by project. And here, this exhibit 2013 shows the difference between the budget as introduced and the working appropriation. And you can see that that top line, $341 million, represents the bond repayment for the original private activity bonds for the purple line. And then the second line includes the payment for the settlement agreement. And again, it's sorted descending as well. So there were some, at the bottom you'll see things that are, deductions, and some of these are just cash flow, where you'll see a negative here, but as we go to the next exhibit and show the difference between the working appropriation and the allowance, some of those negatives are now on this chart as positive, because it was, again, simply a cash flow issue where they couldn't spend it in 22, but they expect to spend it in 23. And that total changes is a negative 477, because again, the purple line spending that we saw come in the two exhibits prior come out in this exhibit and show that decrease. Exhibit 15 shows the significant changes from last year's CTP. So these are projects that were added to the construction program. Those two purple line, unexpected at the time of last year, show up because they are in this 6-year program, but they're in the first year. And then there were projects that are moved from the development evaluation into the construction, and then there are projects that are being added to the development evaluation program that will be worked and eventually end up with projects in the construction program. The first issue is the purple line design build contractor. You heard this in the overview, so I'm not going to repeat that, and I will go to the second issue, which is a discussion. You may recall that legislation required MTA to develop a capital needs inventory of the needs for the MTA system, capital needs regardless of cost and affordability. They released that report in 2019. It showed that there was a backlog of state of good repair funding and a smaller backlog in enhancement needs. In the special session in 2021, legislation was modified regarding this capital needs inventory and requires MTA to annually, going forward, provide a report that shows what was programmed for these various areas and then what was actually expended in the prior year. Because this first report is the first report, MTA submitted the report and provided 3 years of data on programmed versus actual expenditures. So this exhibit, the top is the state of good repair, and the bottom is the enhancement program, and this compares actual spending as a percent of program. So anything less than 100% means that they spent less than had been programmed, and as you can see, for 2021, for state of good repair, they spent about 66% of what was actually programmed, and it varies by element, but the overall category, that's that 66%. We've asked MTA to discuss the factors that have prevented them from spending to the programmed amount. I will note that the report that they submitted, did indicate that the pandemic has caused issues, as we've heard across the board with supply chain, the need to social distance, all that kind of stuff has affected MTA the same as it has everybody else. Issue number 3 comes from budget language that was added to the budget last year, asking for MTA to report on the service provided through the locally operated transit systems. So these are systems operated by the counties, municipalities throughout the state, particularly with regard to providing non-emergency medical transport, or NEMT. The LOTS systems provide a variety of types of service, fixed route, demand response, all the way down through taxi subsidies. Non-emergency medical transport could be viewed in a broad sense as any medical need that's not an emergency that somebody takes transit to access. But the NEMT really is a Medicaid-related term, and there is a Medicaid program in the state that provides a portion of the funding of each state's Medicaid is used to provide these NEMT services. And Exhibit 20 shows that for fiscal 2022, there was nearly $44 million budgeted throughout the state. You can see the county allocations from Medicaid dollars, mostly through the Department of Health, to provide these transport services for Medicaid eligible people that need transportation to these services. So the report also indicated that there are at least 4 lots that are providing some actual Medicaid funded NEMT through contracts. And the report notes that the NEMT Medicaid requirements do require county health departments to screen for the availability of public transportation and to refer clients to those services when available. Interestingly, the Task Force to Study Transportation Access, which was created by legislation in 2019, just released its final report in December, and it also commented on this non-emergency medical transport issue. And it noted that this type of service sometimes requires the level of care and training that transit agencies and nonprofits are not fully equipped to provide. That report recommended improvement of on-demand paratransit programs and improvement of collaboration between medical transport providers as means of providing assistance for transit access. So I guess in conclusions, lots do provide some service for NEMT, but are not the primary method for people who actually, are the Medicaid eligible that need these services. They are guaranteed that under the Medicaid program, but not through lots. The recommended actions for both the operating and the capital budgets are to concur with the governor's allowance. There is one update that I'll just call your attention to. This is bus service to Trade Point Atlantic. There was language restricting funds until they reported on improving service. They provided the report back in September. They had done a realignment of routes and increased service. I just note that that was responsive to the language, and unless the committees have issues that you can bring up during budget or the decisions, that after the budget hearings, this would be put on the list of release of funds letters to be processed. That concludes my presentation, Mr. Chairman.
Thank you, Mr. McCulloch. It looks like we have Secretary Reports and Administrator Holly.
Okay. Yes, sir. Well, good afternoon, Chairman McCray.
Administrator Arnold.
And members of the committee. For the record, as stated, I'm Jim Ports, Secretary of Maryland Department of Transportation. Before I begin, I just want to thank Steve McCulloch again for his terrific work and his presentation on MTA's budget. With me, as you mentioned, today is Holly Arnold, Administrator of the MDOT, Maryland Transit Administration. Let me say it's a pleasure to be before the committee today to share some incredible work that MTA has been doing. Throughout the pandemic, the employees of MTA have shown up every day to provide the critical services that their riders depend on, and we owe them a thanks for that. In addition to keeping riders moving, MTA has been focused on enhancing core service, which includes MTA receiving Board of Public Works approval on October 2021 for the next generation state-of-art fare system replacement project. This $63.6 million project enables MTA to begin implementing a next-generation fare system, which will be phased in beginning 2023 and is anticipated to be fully operational by 2025. The system will include new fare boxes, validation equipment, and ticket vending machines, and expanded retail network and improvements to mobile ticketing. Ultimately, the new system will result in more payment options for customers, shorter vehicle dwell times, and provide MTA with better ridership and reliability data. On top of that, MTA is well underway with their regional transit plan corridor studies. Currently, there are 2 opportunity alignments, north-south, which is from Towson in Baltimore County to downtown Baltimore, and east-west, which goes from Bayview Hospital to Ellicott City. All modes are currently under consideration at MTA and will be operating the east-west plans, opening for the east-west plans for public comment on April, May of this year, and north-south in June or July. Mr. Chairman, these are just a few examples, but it's clear to see that even with all the challenges over the past year, MTA has not slowed down a bit and remains committed to improving transit for residents throughout the region. For the record, we concur with DLS budget recommendations. And so again, I'd like to thank the committee for the opportunity to present today. And I'd like to hand it over to Holly Arnold to address the budget analysis and share a short presentation.
All right. Good afternoon, Chair McCray, members of the committee. For the record, my name is Holly Arnold, and I'm the administrator of the Maryland Transit Administration. And I would also like to echo Secretary Port's thanks of Steve McCulloch for his detailed review and analysis. Steve is always incredibly helpful, professional, responsive, and asks really great questions. So I do have a short presentation that I'd like to share, and then I'll directly address his questions. Will it work if I plug it in here? Okay. Okay, you have this in your packet, so I'll just go through it quickly, wanting to highlight some of the highlights of MTA over the past year. So first is North Avenue Rising. This is a project that I think you're all familiar with. It's our $27.3 million Tiger project, making improvements along North Avenue, along the entire corridor from Hilton to Milton in Baltimore City. It's a joint initiative with MTA and the city, and it's been really successful so far. This past fall, we launched 7 new miles of dedicated bus lanes in the city, and we're continuing to invest in that dedicated bus lane network. Along those lines, we also were awarded a RAISE grant, which is the new version of Tiger. So it's a $50 million project for our east-west priority corridor, also in coordination with Baltimore City. This is a 20-mile corridor in the city and county, and we're going to be investing in transit, ADA, pedestrian, and bicycle improvements, including an additional 10 miles of dedicated bus lanes. On the customer experience side, that is a huge focus of mine to continue to invest in our customer experience and ensure that our riders are getting the best experience that they can. There's a lot on here. It's in your packet, so I won't highlight all of it. But I did want to note on the real-time side, we now have real-time vehicle tracking available on our core bus system, commuter bus, MARC, and Metro. And we're well underway with light rail, anticipating launching that later this spring. We also have real-time bus crowding information. That's something a lot of folks requested during the pandemic to make those decisions on whether or not to ride the bus, depending on how crowded it is. So we're excited to continue to invest in and launch those real-time investments. Improving mobility service continues to be a huge focus of the administration. Sharing a similar chart here as Steve did. Ours does include this past January, where we've seen the highest on-time performance since February of 2021. We know we're not yet where we need to be, and we're going to continue to focus on this. A few of the things that we've done are really working with our contractors on recruitment and training. So a big piece of that is the wage increase for the operators that went into effect October 1st of 2021. And you can kind of see we had our lowest point was in September of last year, and that wage increase had an immediate stabilizing effect to bring us up about 9% from where we were on the system, because it included the existing operators as well as anyone new coming in. Since then, the contractors have been able to continue to bring on operators, train them, and they're up about 40 operators from where they were at that low point. We continue to assist them with recruitment, even using our own buses and our resources to help them recruit employees, because it is such a vital service. We're also working on different options for them. One is increasing the limit on the call-a-ride service. So previously it was $20, so a rider would pay the first 3, then we would cover up to $20. We now cover up to $40, which pretty much allows a rider to go anywhere within the system. So that is an option that people are able to use if they would like. We're working on an app for mobility, to give choices so that people can use their phones to book their trips, make cancellations, and they'll be able to see real-time vehicle tracking, bringing it in line with the rest of the system. We're expecting that to launch later this spring. And I think the most important one is we took to the Board of Public Works last week 3 new operations and maintenance contracts. So we, back in 2019, went from 3 contractors down to 2. And we are now increasing that again to 3. I think we learned that our service is just a little too big for 2 contractors, and having that 3rd contractor will give us the flexibility that we need to really bring the service back to where it needs to be. We also have built into those contracts, I think, some of the first in the industry changes to really incentivize staffing, on-time performance, and timely service. And so those have been issued in TP, and we'll be starting to see those operators coming on board soon for the 3rd contractor. And I did note in this past January, we saw the highest on-time performance since February of 2021. We're going to continue pushing on this to get where we need to be. I want to talk just briefly on overhauling our rail fleet. Those continue to be some of the biggest expenditures in our system outside of the Purple Line. So we're well underway with replacing our Metro cars and overhauling our light rail vehicles. And we have begun planning for new light rail vehicles to replace the existing ones. Zero emission buses is also a big focus of the agency. I'm not going to go through details here, but we're well on our way toward meeting our goal of transitioning to 50% zero emission buses by 2030. And we have started a pilot at our Kirk Bus Division. We've ordered 7 battery electric buses, and we're in the process of retrofitting that facility to bring in the charging equipment. We're working with our unions to do the training that's needed, because these are such a different bus than what we're used to. And then finally, we've launched our Fast Forward program, which is really trying to see what kind of quick customer experience enhancements that we can make to the system, recognizing the need to be faster, more accessible, and easier to use. So we're going to continue to invest in the dedicated bus lane network and work to expand that in conjunction with the city, making ADA improvements so that our system is accessible to everyone, and then looking at signage and wayfinding to make it easier to use and understand. MTA and September of last year, launched our strategic plan outlining how we're going to move forward over the next 3 to 5 years as we recover from the pandemic. There's a number of goals and objectives in there, and one I did want to highlight is just how we're kind of centering equity in every decision that we make at the agency. It is a key component, and we are now looking at prioritizing equity in our service planning and as we do our resource allocation, including in our budgeting process. And so with that, I would like to respond to the issues that the DLS analysis brought up. So I did cover the mobility issue and the PowerPoint, and I'm happy to take any questions on that when we get to that point. In response to the second request in our analysis, which asked that we brief the committees on the steps that we're taking to address the gap between program capital spending and actual expenditures. So I'll note that it's always our goal to have our program capital budget closely align with our actual expenditures. As Steve did note in his analysis, the past few years have brought with them additional difficulties when we're considering the program budget compared to the expenditures. Primarily the pandemic has had a huge impact on our ability to spend our capital dollars. We've had project work disrupted by quarantines from our contractors and employees, material delays due to the supply chain, and crew availability across all of our projects. Through it all, our team has really been focused on delivering the projects that our riders need and deserve. And as we emerge from the pandemic, we're really focused on trying to adjust project schedules based on this new reality and try and more closely align the budgets to that. So we're going to continue to focus on this, and we believe that these steps will help to address the discrepancies between our program dollars and the final expenditures. And then for the record, regarding the DLS recommendations, we do concur with their recommendations. So with all of that said, I'm happy to turn it back over and answer any questions from the committee.
Thank you. That's a number of questions. I guess I got a couple of them that have been asked by a number of our advocacy communities that's out there. I'll start with the commuter service. In reference to just the safety plans that are put together, the age, the maintenance of the building, how not the building, but the vehicles, how often are these inspected?
So we have a regular inspection process that our team does and has done throughout the entire pandemic. We've also built into our contracts requirements to have kind of newer vehicles. So the vehicles can't be older than 10 years old. In the past, that wasn't the case. This is something new we've built in. I'm happy to follow up with more details on the specifics of the inspection process, though.
Yep. Obviously, regular is pretty generic. If you're doing it every 30 days, 90 days, 120 days, that would be helpful because obviously it's being questioned of the committee from that standpoint. I'm going to stick with commuter service and just talk about from a contract standpoint and in reference to when you all are evaluating contract. Can you speak to how you take in consideration contractors that may have had suits, claims filed against them in other jurisdictions? And the one that I'm really referencing is one in New Jersey recently, February 11th, where one that does business with Maryland was paid a settlement under the False Claim Act of $20.5 million for overbilling in reference to the busing piece of it.
I think I'm going to have to follow up with you on that. I believe that they're required to disclose any of those things as part of the process, but I don't have the specifics on that one.
Okay. The next part that I'll go on to, because the mobility piece is very huge. Obviously, you know that. We've talked about that. I'm going to lean in reference to, we have a goal of 92%. Goal 2019 on a number of different periods, we're falling shy of the 92%. Folks are concerned about in reference to just the wheelchair mobility piece of it. So you talked about if the bill inside your testimony, if the bill for the TNCs pass. Can you speak to like how many of those TNCs will be offering wheelchair accessibility opportunities for those folks that catch mobility, whether that service will be able to be offered the same day, and like what percentage are we trying to allocate or look at, like what is our goal from that standpoint?
Okay, yeah, so you're talking about the TNC legislation that Senator Hedelman has introduced and that we support. So the TNC service would operate, Uber Lyft essentially, would operate very similar to our call-a-ride service. So traditional mobility does not change. So anyone who wants to use that, there's no changes to that. This would be a supplemental service that people are able to opt into. It is similar to Call a Ride, a same-day service. You can call and request it the same day. It is not like our mobility door-to-door service. It's curb-to-curb. So people who need additional assistance would need to use our traditional mobility service. The goal of this is really just to provide other options for our riders so that they are able to use this if they would like. In regards to the wheelchair accessible vehicles, we've been working closely with Uber and Lyft and requesting as part of the contracts that they have a minimum of 10 during the peak service when they first
10% or 10 vehicles?
10 vehicles when they first launch, with the goal of increasing that as quickly as we can. And we are willing to work with them in terms of us providing vehicles, things like that, to ensure that our riders who have wheelchairs have the same accessibility as everyone else.
Yep. How many vehicles do you imagine in totality?
So
10
really,
out
it's just
of-
gonna be on demand. So we're not requesting a certain number of vehicles. A mobility rider would get certified and be certified in the app, and so then they would just be able to, same as you call an Uber. Call an Uber, they would be able to see what the price is, which gives them that additional assurance that they're not gonna go over that $40 limit, and then a car would come the same as anyone else.
So obviously you have a vision of 10, and obviously that's going to scale up, but do we have a vision of like how many hours? Because the goal is same day, so like how many hours would someone with that needs wheelchair accessibility have to wait for the TNC before they would be able to get service?
So I don't think we know yet. I think
Okay.
that as we work through the contracts, because we currently can't enter into those contracts, we need the legislation. And so as we would work through that, we would work with Uber and Lyft on that. Again, the goal is to ensure that our mobility riders are treated the same way as anyone else who uses an Uber and Lyft. And so, sometimes there's peak periods, and that does happen, but we would try and reduce that as much as possible, and again, provide that option for folks. If someone isn't comfortable, they're still welcome to use our traditional mobility service.
Yep. So Colorado already exists, and this is my last questions. Colorado already exists. Can you speak to what percentage or how many Colorados do we have for specifically wheelchair accessibility?
I will have to follow up on that. I don't know. I know that it's been a frequent complaint that there's not enough, and so that's one reason to have additional options, right? So people can use Call a Ride and have that service, and Uber and Lyft if we're able to do that.
So for the Colorado, obviously, if Corey McRae wants to catch Colorado, I can get it that same day. And I'm hoping that our goal for wheelchair accessibility is the same goal. Yep, from the same thing, but help me understand, like, what percentage is being met from the same day for wheelchair accessibility?
On the Call a Ride right now?
Yes, ma'am.
I don't have that in front of me. I'll have to follow up with you.
Okay, perfect. Senator Jackson?
On mobility, it's 100%. If someone
Right.
requests a mobility vehicle, we're fully meeting.
We're regulated to do that in one day.
Thank you, Mr. Chairman. I'd be interested in that wheelchair information as well. So a couple of things that I still have regarding mobility. So obviously during COVID, supply chain issues. So was there an impact on the servicing of your vehicles during that period of time? I know you do regular inspections, but did you experience any challenges?
No, we haven't had any challenges with
terrific.
the vehicles. Really, the challenge is having enough of available operators.
That's terrific. Your contractors that you have, and then during the COVID period of time, and as we're hopefully coming out of this, did you experience any challenges in that regard, your contractors on board? I know you talked about having folks to do the work.
Yeah, so our two contractors throughout the pandemic have been First Transit and TransDev. We've worked incredibly closely with them throughout the entire pandemic. I think one of the first things I did when I started in this role was bring them in and talk about the service and the importance of it. Daily, weekly meetings to review where we are and where we need to be. And so they have been committed to bringing on the operators. They have done hiring bonuses, so $2,000 hiring bonus to come on board. Worked with us on the wage increase, and under the new contract, the same thing. We're going to have an even higher wage increase, and the third contractor, who's going to be MV, is actually ready to go already with 40 operators who are starting training now to bring them on as soon as we can.
Okay, just to add to that, a question that comes from that. So we have a contractor on board, or we have a contract in place. We hit COVID. Were there any abnormalities in the contract, the length of the contract or duration of the contract Did we have to make any adjustments to the contracts going forward?
So we had already been working towards this new contract that's starting now. And so in terms of the contracts that we had, we did an emergency procurement to change the wages to allow them to go up to $18 an hour for the contracts, just to ensure again that we had the operators that we need.
Got you. And last question for me, this is, hopefully everybody is on board with this one here. Mobility and use of the system, speaking of contracts, if Major League Baseball can get their stuff together, are you guys prepared to see that influx of folks coming into the city for the games coming up?
We're always ready for more riders.
Cool. All right. Thank you, Mr. Secretary. Thank you, Ms. Arnold. Mr. Chairman, that's it.
Thank you. Senator Salin.
Thank you, Mr. Chairman. First of all, I want to thank you for working with Trade Point. I know it's a place that is developing, as you know, and it's going to continue to develop. And the next couple months, they are going to have ribbon cuttings, and they're going to continue to develop. They're going to have more employees. And I know that we need to expand more, and I know we're looking into that. And I know the west part of Baltimore, they need that opportunity, and going through the city of Baltimore. We did have in place at one time the areas that we serviced. And I'm wondering, are you looking at that we used before, the 4, the 22, the old, that came down in the areas which I grew up. But it came through the city, right to Baltimore County, down Eastern Avenue, North Point Boulevard, 151, right to Trade Point Atlantic. And part of that went through the city of Baltimore also. Are we looking into that? And also, are we trying to expand even more? Because there's so much opportunity, as we know right now, and we're going to make sure that we're in place so we can get the services there. So thank you.
Yeah, I mean, we're always looking at where we're providing our service, how we're providing our service, and the needs of employers and the needs of riders. So Trade Point Atlantic, we communicate with regularly, spend a lot of time kind of making sure that we're providing that service because it is a huge employment center in the region. So as you note, this past fall, we launched the 163 Express Bus, which goes from West Baltimore to Trade Point. It cuts about 20 minutes off of that travel time. It very quickly became one of our higher ridership express bus links and was incredibly popular. We also made some changes to the local link 63, which also serves Trade Point, to better serve some of the communities north of Trade Point Atlantic. And then, our service development team is regularly looking and continues to look at Trade Point and how we can better provide access to those jobs. So we'll continue to do that and look forward to, if there's any specifics, we're happy to work with you.
And Senator, I could just tell you that from day one, I was down at Trade Point Atlantic working with Aaron Tamarchio. One of the things that we stressed is not just the employers being there, but working with their HR groups to find out where their employees live. I don't need their exact address, but at least the zip code and the area where they might be coming from, because you can't just set up a new route and hope that people are going to ride it. What you want to do is you want to do the back end, or the front end informational stuff with HR, find out where they're living, find out how we can get capacity up in a bus, and then provide that service to those organizations. We did the same thing with Amazon when they opened up. That was a new service that we provided, and we're doing the same thing with Trade Point Atlantic. We've gone over all that with Aaron Tamarchio and his team, and we continue to do so as they expand. So you can bet that if they're providing jobs, we want to provide service.
I appreciate that. Thank you very much.
Sure.
Thank you, Mr. Chair.
Senator Edwards.
Thank you, Mr. Chair. This might be for Steve versus Secretary. Last year or the year before, Senator Quarterman pushed this issue, and I thought he either put a bill in or we put something in budget language about studying running Mark to Hagerstown and then going out to Cumberland. Did we do that?
There was legislation that got passed.
And that leads me to my question then. Where are we on that?
Yeah, so we are working on that now. So this Maryland statewide transit plan is currently out for public, or just finished with public comment, and does include some service to Western Maryland in that as part of the discussion. We also have launched a master plan for the Brunswick line. So kind of across the board, looking at the needs of the Brunswick line, taking the cornerstone plan and breaking it down into kind of more bite-sized digestible chunks in terms of how we would break it up for projects. And a big piece of that is looking at expanded MARC service in Western Maryland. So the Brunswick Line Master Plan, we'll have a draft of that out later this year. And the goal is to kind of get feedback from the public. Are these the right things? Are these the right projects? Are these the right goals that we're looking at? And so I'll make sure that you get a copy of that when it comes out.
Okay, thank you very much. Thank you, Mr. Chairman.
Seeing no further questions at this time, just want to thank you all for your service to the state of Maryland and what you all are doing. Look forward to some of the questions that was asked, get the answers and responses offline. So thank you, Secretary Ports and Administrator Arnold. And Mr. McCulloch, just thank you as usual for what you do and keeping us straight.
We'll see you tomorrow.
Colleagues, that was the last hearing for PST, and that ends our agency hearings for the day. Thank you.